Hi, good morning. I wanted to go through some of the um, disorders that are under schizophrenia and spectrum and psychotic disorder related. And so I am using the Diagnostic and Statistical Manual of Mental Disorders. For those who don't know, it's the fifth edition text revision, that's why it's TR. And this is a book that is used to guide, offer standardized criteria for diagnosing mental health disorders. So when you talk about what is uniform for everybody that is going to be diagnosing, of course those who are licensed and trained to use it. This is not a diagnosis that I'm giving, it's just an introduction to my students on this disorder, or anyone that is learning wants to know. So I'm going to start with the symptoms for brief psychotic disorder as they are outlined in DSM-5-TR. So the presence of delusions, so the delusions would be holding false beliefs that are firmly held despite evidence to the contrary, so they do not exist if someone else is looking from the outside, but the patient believes that those beliefs are valid. So for example, such as believing that one has special powers or is being persecuted. There's gonna be different categories of delusions or delusional disorder, so definitely these are just symptoms for the brief psychotic disorder. So the other one is hallucinations, which is perceiving things that are not actually present. So someone might say, I'm hearing voices or seeing visions, but looking from the outside for someone else doesn't see them, but the patient seems to hear or see what they are talking about. So the disorganized speech, which is the third symptom that you would be looking at. Just the disorganized speech means incoherent or illogical speech patterns that are difficult to follow or understand when the patient is talking or trying to talk about whatever they are going through. So they are, of course, the grossly disorganized or catatonic behavior that is, or extremely disorganized person seems to be. They display unpredictable or bizarre behavior. They're agitated. They just aimlessly wander. They might remain immobile for extended periods. So that's what you're talking about, the catatonic behavior. Just it's bizarre. They might some of the other things may include, as we talked about, hearing voices. So if you hear somebody that is saying that they are hearing voices, or they have these beliefs that they cannot be validated, they could be having the brief psychotic disorder. So for the duration, we don't diagnose or conclude that someone has this disorder if the the symptoms have been there for more than 1 month. That is going to be another disorder. But for those that have had these symptoms between 1 day to 1 month, that is what is called brief psychotic disorder. So let's say, for example, somebody has undergone through a very major stressful event or trauma. They might have a brief psychotic disorder that might actually be maybe because of psychotherapy and medication. The disease might disappear and not last for more than 1 month. That would be diagnosed as brief psychotic disorder. Thank you so much for listening. I'm going to be bringing the other spectrum and psychotic disorders that are under this category for you to listen to. So thank you very much. Those are brief. This is, as I said again, disclaimer, this is not a diagnosis. So for the diagnosis to happen, there's a little bit more that needs to be done by the therapist or whoever is diagnosing these sicknesses. So you can see a client by just looking at them because of this. You might give them a provisional diagnosis, but there is a process of diagnosis that is a little bit more extended. Okay, so thank you for listening.